I'm with the Healthy Homes and Lead Poisoning Prevention Program. So I start with this statistic. I know you've already had some data this morning, our most current data from Beverly Druin and Kathleen Bush, but I wanted to give you an overview for our entire state. So between 2014 and 2018, we've had 3,402 children. 3,402 children during that block of time who had an elevated blood lead level, meaning they were tested and they had a blood lead level greater than 5, which is the CDC's reference level for having been exposed to lead and in need of case management. That averages out to about 680 children a year, year after year after year in New Hampshire during this block of time. And at the same time, we've had fewer than 24% of our children tested during this block of time. So you have to picture that we've found this huge number of children while we're testing this very small number, so that we know that this is highly underreported in New Hampshire. We know that there are more children, so to speak, out there unidentified who've been exposed to lead. So just a quick background on lead as a poison. I often refer to it as the perfect storm or the perfect poison for young children. Just so you have an appreciation, lead tastes good. I hope you don't know that, because I hope you've never tasted it, but it tastes good. So when children get it on their hands and their toys and their pacifiers and put it into their mouths, it tastes good. There's no deterrent. There's nothing that's making them say, oh, this tastes awful. I don't want to put this in my mouth anymore. And you probably are aware, but just for a reminder, children under the age of 6 don't have a blood-brain barrier. That's Mother Nature's fantastic filter. If you picture a brain, it's kind of a weave, a mesh over your brain that protects your brain from toxins, heavy metals, mercury, lead. Children under the age of 6, that just hasn't fully developed yet. So the little guy you're seeing on your screen right now, his brain is a sitting duck. If he gets lead on his hands and toys and pacifiers and puts them in his mouth, they're going to circulate through his blood and go right into his brain. Lead is also what I call stealth. It's under the radar. You don't see the impact of lead on children until they grow older, and then it's too late. That's why the testing is so important. But this little guy on your screen and others who are exposed to lead being poisoned at levels that are going to cause long-term consequences, learning disabilities, speech and language delays, significant behavior problems. These children are going to look healthy and act healthy. The only way we know is to test. I often compare it to, God forbid, a child gets into some household chemical or something in your medicine cabinet. If they're going to give you some type of red flag, if they're being poisoned by something else, they're vomiting, they're lethargic, they're unconscious, they're having a seizure. You might not know what they got into, but something's seriously wrong. Lead doesn't give you any of those red flags, none. They look healthy and they act healthy. We also know that it only takes trace amounts. I'm going to use this opportunity to kind of myth bust. There's the appreciation that children have to eat paint chips about this big and then kind of eat them like Doritos to be poisoned. Well, in fact, children only need to come in contact with trace amounts. The amounts on your hands, toys, pacifiers, your household floors that you won't even see that will poison a child. If a child, in fact, eats a paint chip, even a small, very small one of lead paint, they will be very, very sick from acute toxicity, and it could even be fatal. They could die from it. All the while, these aspects of lead, children are in the oral stage, they're putting everything in their mouth, and they crawl on the floor, sit on the floors, pulled to standing on surfaces, all these surfaces where lead dust collects because lead is a heavy metal. You put all of these together, including the fact that their brain is rapidly developing. You put all of this together and we have the perfect storm or the perfect poison for young children. And you may be aware as well, but between birth and two, children's brains develop so rapidly. They're developing all the architecture, the infrastructure, if you will, for the rest of their lives. And when that's damaged by lead exposure, there's no easy way, if any way, to make up for that damage. It's irreversible. And lead poisoning in young children in the United States peaks at 18 months, right at that time that so much of this rapid brain development is going on. So what I have on the screen, if you will, is human thinking, taking you back to high school biology for a moment. But this is important to understand what lead does within a child's brain. So this is two synapses, the sending and the receiving, and all around it's black here, there would be calcium ions floating. Calcium is what actually makes this whole engine function. A message comes along, calcium goes in, neurotransmitter comes out, that message goes across, calcium comes in again, which sends a message back. So this whole system stays healthy and the message goes along. Your brain runs on calcium. So when lead goes into a child's body, the human body actually has no idea what to do with it. And it interprets it as lead because lead and calcium are very, very similar in the molecular structure. So when a child's exposed to lead, lead is floating around everywhere on your screen that's black, along with the calcium. And when the calcium goes into these synapses, when signals come along, the lead goes in as well. At best, it gums it up and the system doesn't work well. Neurotransmitter doesn't come out, message doesn't go across, this synapse over here doesn't send the message back, so the synapses start retracting and actually dying off. So yes, lead kills synapses in a child's brain. In addition to that, if lead is floating around when these synapses and other parts of a child's brain are actually forming and growing when they're 1 and they're 2 years old, that lead permanently damages, mutates those structures. They don't grow, or they're not the right size and shape, or the insulation that's on them starts getting holes in it or doesn't grow at all. Lead wreaks havoc in a child's brain. So I want to show you what this actually looks like. I'm about to show you an MRI scan from the Cincinnati lead study. And we're going to talk a lot about that study because it's the longest running longitudinal study in the world. What does that mean? It has followed children, both that were poisoned, exposed to lead when they were in the uterus as fetuses, as babies. They were poisoned then, or they were poisoned as very young children exposed to lead, and it followed them through adulthood. So this is where we see so much of the impact and have the long-term studies on what happens to children when they grow into adults. So Dr. Kim Cecil is the lead imaging researcher, and she has MRI scans of children's brains that have been exposed to lead. So this is a male child about age 8, and he had a test result of 13.4. Everything you see on the screen should be gray. You'll hear gray matter. But everything you're about to see that's red, yellow, orange, that's all areas of a child's brain that have been damaged, where there's less gray matter as a result of the lead exposure. I use this slide wherever I train, and I use it including when I train pediatricians and medical clinicians, and they are very That's a first one. I apologize. Sneezing during a virtual conference. Everything you see on this screen that's red, yellow, orange, those are areas of this child's brain that have been damaged. And our pediatricians, including I'm sure yourselves and everyone else that sees this slide, are really very, very startled, really impacted, concretely seeing all the parts of a child's brain that are damaged. And the piece I hear from our pediatricians a lot is just really how pervasive. They're really surprised to see how pervasive the damage is, meaning it's not just one part of a child's brain that's damaged that we might be able to kind of work around. that the damage is throughout a child's brain. I want to point out to you up top here, the right up top in that top slide, that's your frontal lobe, the front part of your head, if you will, your forehead. That's your executive function. So that's what makes us human. It's what separates us, if you will, from the animal kingdom. It's our pro-social behavior, our ability to plan, strategic planning. It's our speech and language. This is our critical part of our brain, our decision making, being able to evaluate rewards and consequences. That is a key part of our brain that makes us human, and you can see how significant the damage is. This is where we're able to control our emotions, where we're able to control our behaviors, our impulses, and you can see how virtually hollow this is. This back part of the brain is also a significant part as well. That is where both sides of your brain communicate. It's also visual and spatial interpretation, so where we interpret symbols. So this is reading, letters, numbers, math. This is why children who are exposed to lead have such a difficult time learning to read and to do math and just basic academic tasks, because you can see the impact on the back of their brain, the parietal lobe. So this is the Cincinnati Children's Hospital. And as I mentioned, the Cincinnati Children's Hospital and the University of Cincinnati have conducted the longest study in the world of children basically from before birth or after birth, if they're poisoned after birth, through adulthood. And I'm going to show you some of the outcomes from this study so you can begin to see the impact, the cost to our communities in New Hampshire and throughout the United States. So this study has shown unambiguously lead is bad. It's not that lead might cause this or could be a risk factor for. Lead causes these bad outcomes with long-lasting, unambiguous impact on intelligence, behavior, and health. And the study has also shown that a little bit of exposure in early childhood can have really large, long-term negative consequences on children's behavior. And I think we hear a lot about lead and kind of brain damage and learning disabilities, but you don't often hear, or people don't fully appreciate how much lead exposure in children causes behavior issues, behavior challenges that we're going to talk about. They're more impulsive, they're more aggressive, they can't control their behaviors and their emotions. In a nutshell, the Cincinnati lead study has shown us that these children have a lower IQ. In the Cincinnati lead study, the average IQ for children exposed to lead was 86, and kind of in a normal, healthy group of young children not exposed to lead, the average IQ is 100. That's 14 IQ points. And if those of you know about IQ, that is astronomical. That's the difference between functioning well as an adult and not functioning well as an adult. Obviously, they don't do well in school. They have lower test scores. They have lower achievement, significant behavior problems. And the Cincinnati lead study showed us so concretely this lasts through adulthood. So the Cincinnati lead study has put out a term called lead's neurobehavior signature. And it's very similar to the autism umbrella, if you will, or the autism spectrum. It's an umbrella of the different areas in a child's development or domains, different areas that are going to be negatively impacted by lead exposure. And you'll often see them present. You'll see a child having more than one or two of these difficulties. So these children have very poor attention. They're inattentive, they're impulsive, they're much, much higher rates of hyperactivity and attention deficit disorder. Executive function, that was that frontal lobe that we talked about. So these children can't control their impulses. They don't have the flexibility of thought. They can't monitor their own behaviors and emotions. They can't control them. Visual and spatial delays, that was what I talked about, the back of the brain. This presents itself as the children try to learn to read and to do math. Those tasks are very difficult, if not impossible. Significant behavior challenges with children exposed to lead as they move through elementary school and onward into adulthood. They're impulsive. They lack emotional regulation. They go from 0 to 100 with their emotions, whether it's anger or otherwise, in a heartbeat. They're antisocial behaviors, they're oppositional, they're aggressive, destructive behaviors. Speech and language delays, actual hearing loss, and processing disorders. And fine and gross motor delays, they're not coordinated, their sides of their brain don't communicate well, so they have very poor bilateral communication. So things like riding a bike are very difficult, or crossing your midline to ride or do athletic pursuits. So you put these children that are exposed to lead, that have that brain damage, if you picture that MRI scan, and you understand lead's neurobehavior signature, what the consequences are for them. These children then, as they move into our school system and grow through adults and move through society, they continue to have difficulties, and there's a huge economic cost. The Cincinnati lead study and others have shown that almost all children exposed to lead end up in special education programs. They engage in more risky behaviors, more teen pregnancy, more school suspensions and dropouts. They don't graduate, more substance abuse, more juvenile delinquency and detention, meaning they're in trouble with the law before they're even 18. They abuse and neglect their own children, and they engage in more criminal adult activity. And we're going to talk about that as well, because that is another huge economic burden to our communities because of lead exposure. But all of these things, all of these consequences have a huge cost to our communities. What is the cost in Nashua or in New Hampshire per child who's enrolled in special education? What is the cost to our support services when we have teen pregnancy? What is the cost to our communities when students don't graduate from high school and then are not able to get jobs? What is the cost to our communities when children are abused and neglected? And what is the cost to our community when we have violent adult crime, to the victim, to the community, to then the criminal justice system? So I'm just going to give you a couple of examples of other communities that have looked into the aspect of what it has cost them for children that have been exposed to lead. So this is Ralph Spezio, and I hope you do a little further work into exploring into his story. So Ralph was a principal and then superintendent of schools in Rochester, New York, and he has since retired. But he has a TED Talk and many different articles, and he tells the story that he knew nothing about lead exposure in Rochester and had no understanding of the impact on the children in his schools, other than he knew he was a pretty transformational superintendent and educator, that he had groups of children that no matter what he was putting into place, and he was doing amazing things, he was not able to move these groups forward. And he tells the story that one day he was walking down the hall, two school nurses were talking, and he hears one school nurse tell the other school nurse, another child's coming in who's been poisoned. They've all been poisoned. And he turned on his heels because he had never heard this before. Long story short, he was so startled by this, he went and got the medical records for all of the children enrolled in Rochester, New York public schools. And at that time, they did not have universal testing. But of the records, and he got the records for everyone, of the children that had a documented test in their records, 41% of the kids, so 41% of the children in Rochester, New York public schools had an elevated blood lead level, had been poisoned, had been exposed to lead. He was shocked, and he said he most likely had many other children, or he had other children showing signs and symptoms, but they didn't have a test, so he didn't have a way of knowing for sure that lead was the source. In addition to that, of those 41%, so all of the children in Rochester, New York public schools that had an elevated blood lead level in their medical record, all of those children, 100% were in special education programs. What is the cost of that? Not only to the child and the family, but what is the actual dollar cost to our communities for children for a lifetime in special education? Ralph has gone on to do amazing work, not the least of which New York moved to universal testing. All children are testing. They did amazing outreach and education to families, work to make housing safer. It's the model and the story that we'd like to duplicate in many of our, if not all of our high-risk areas in New Hampshire. And going along that special education outcome, this is from just about a year ago, September 6th of 2019, right? This is Education Week, national publication for higher education in the United States. There's been a 56% increase in special education enrollment in Flint, Michigan. 56% increase. It says the schools are overwhelmed. They were drinking the water with lead in it for 18 months. We have a 56% increase. So I want to talk beyond IQ. You often hear lead lowers IQ. Lead causes brain damage. People don't always connect all the other aspects, like I mentioned, of behavior. But lead, we know, lead exposure in young children has a greater impact or increase in adult violent activity, violent crime. So this is a book titled Lucifer's Curves, The Legacy of Lead Poisoning. I'm going to talk about those curves a little bit. And Rick Nevin, you can buy this book for like $6.95 online. It's available electronically. He's a physician and an economist. So you may or may not be aware that we actually chose to put lead in gasoline. It was not something that naturally occurs in gasoline. We put it in as an additive early in the 1900s. And we put it in, and then we eventually started phasing it out in the 1980s and 90s. So this graph that you're showing, accounting for time, meaning children needing to grow up, the green line shows the average lead level in preschool children. So we started putting lead in gasoline over here where my cursor is, more cars, more highways in the United States. All that lead comes out the exhaust. So here we go, more children, more cars, more lead, blood levels go up. We started phasing it out, blood levels started to come down. The blue line shows the number of violent crimes per 100,000 people. We put more lead in children's bodies, violent crimes go up. We started taking lead out of gasoline and out of children's bodies, violent crimes come down. If you look how closely they follow each other, it is really extraordinary and almost unheard of. And this has been repeated over and over again, this study, this research. This is actually a British study, same outcome, slightly different approach. This study looked at the amount of lead in the gasoline consumed in the United States in tons. You can see the British spelling. So how much lead was in the gasoline we used in our cars and our trucks, and all came out the exhaust. So you can see we put lead in gasoline, more and more cars and trucks, and then we phased it out. And then you can see same thing, violent crime per 100,000 people. It's really startling. But what is this telling us? It's telling us the more lead that's in the human body, the more violent the human body becomes, the more crime we see. This is a 2014 report of New Hampshire data. This report looks at economic burden of environmentally attributed illness in children in New Hampshire. So environmentally attributed would be caused by where the children live. So it looks, for instance, also at asthma. And what's the cost? Emergency room visits, special education. Actually, this report didn't include special education, but emergency room visits, special medications, all the other costs to our communities. So if you look at this, you can see the number of crimes contributed to lead in New Hampshire, 987. And you can see the cost, and this is $2013, so 7 years old, of almost $9 million. And again, we know this is highly underreported because in this time, so few children, or in this case, adults, were even tested that we would have lead exposure documented in their medical records. So this is New Hampshire data. So you can see it's real in our communities, crime caused by lead and the huge cost, not only to the victim, of course, but to the taxpayers and the criminal justice system. This is from the Cincinnati Lead Study, and they documented the results of those that were in the study, and this is from 2018. And they found that any 5 microgram per deciliter increase in blood lead level increased the rate of arrest for violent offenses by 48%. It's really pretty startling. And this, I should go back. This was a child's blood lead level at age 6 years of age. So they could predict by the blood lead level of the child at age 6 how likely it would be that they would be engaged in violent criminal activity. So an economist named Elise Gould did some of the groundbreaking work and figuring out, kind of doing the tally as to what it would cost or what it would save us, if you will, if we addressed lead paint hazards. You know, if we started preventing lead exposure in young children. And very conservatively, her paper I cited at the bottom, she actually lists conservative estimates for social and economic benefits that she puts forward in her paper, that if for every dollar we spend, we're going to end up saving anywhere between $117 and $221, in essence, in taxpayer dollars, because of all of the outcomes you just saw me list, we would prevent or reduce. And she argues that there would be a net savings if we prevented lead exposure of close somewhere around 250 billion with a B savings. And where does this come from? You know, she details it very well in her document. You know, reduction in healthcare costs, reduction in social behavior costs, and the high cost and collateral consequences of educational attainment. So what is that? That's all our special education costs and associated costs with us. I mean, she goes through and looks at, as I just mentioned, the special education costs. You know, I mentioned the much higher rates of attention deficit disorder and hyperactivity and what we spend on that annually, and also the crime, you know, not only the incarcerations and the legal proceedings and the loss of earnings, both for the criminal and the victim. You know, she has there 1.8 billion. So the cost is pretty staggering. And as I begin to wrap up, I always put out, you know, this is preventable. Children don't have to be poisoned. It's preventable. We can prevent this and save so much in terms of the child and family's life and potential, but also our taxpayer costs and the economic burden to our communities. As I begin to wrap up, and before I move to question and answers, I just want to show you a couple quick documents so that you're aware. One is Educational Interventions for Children Affected by Lead, a first of its kind paper that came out relatively recently in April 2015, put out by the Center for Disease Control with a panel of both CDC and non-CDC experts. Also, many are not aware of this. This is from the U.S. Department of Education, so our federal agency, and the Office of Special Education. They do idea briefs, if you will, topical issue briefs on different issues in special education, and this is the one on lead exposure. And it has a whole rubrics for working with infants, toddlers, children, and youth who've been impacted by lead, all the different domains, how you would need to change your teaching practices, how to best support these children, how to modify your environment. Finally, if you're connecting with your school system or any of you are educators, This is an excellent, excellent paper, relatively recent, February of 2016, by both an attorney and a pediatrician, led in its impact on learning, what schools, parents, and policymakers need to know and do. And finally, if you haven't seen this documentary, it's called Misled: America's Secret Epidemic. You can now screen a final cut of it on YouTube. That's Tamara Rubin and her four children. That little boy in the sleepy suit is her son Avi, and he was 9 months old when home renovations that weren't done properly by a hired contractor resulted in all of her children being exposed to lead, but especially Avi, who was just 9 months old at the time. She went on to create this fantastic documentary on this issue throughout the United States, soon to be released, but you can watch it, stream it free of charge in a final cut version on YouTube. Finally, I hope that you take out your phones and will put us in your phone so that you can follow us. You can follow the New Hampshire Division of Public Health Services, both on Facebook and Instagram. And they're all our lead program posts information very frequently, as do all of our public health programs, so you can keep in touch with us. And finally, I'm going to stop sharing my screen, and I'm going to answer any questions that participants might have, and Patty will be our moderator.
Thank you so much, Gail. What wonderful information you shared with us. It was a really informative presentation. I have put a note into the chat asking if people do have questions for Gail. You can enter them right into the Q&A tab, and we'll be able to get her to answer those for us. If we run out of time, we can always have those answered and then can send them out after the conference today.
Well, I appreciate this opportunity very much today.
So we do have one question, Gail. Sorry to interrupt you. What do you think NASH's next step should be?
What could NASH's next steps be? I'm very interested in trying to help our school systems and our special educators and our superintendents understand the impact of children who've exposed to lead that are coming in their doors. Not only in terms of helping them understand how they can help and support these children with some of the documents that I've just shown you to get their staff educated, but also to understand that this is preventable and understand the impact on special education enrollment and probably the burden on their system, not only in terms of staff and demand, but obviously the economic cost. So besides reaching out to your schools and your superintendent and to bring subject matter experts to them to educate them and train them on lead exposure, as other communities such as Claremont has done, and Pittsfield and many other communities have had me and other members of our team come and train. But I also would really strongly advocate for Nashua and every school district in New Hampshire to put a policy in place that children coming into school on their health forms, their blood lead level tests need to be documented. The same way that your chickenpox vaccine and your MMRs and all your immunizations have to be documented, your blood lead level test should be documented as well. And City of Claremont did that a number of years ago before we even moved to universal testing. Those blood level tests are now required by law in New Hampshire at age 1 and age 2. So you're not asking for anything that isn't already required. All you're saying is that it needs to be documented on the child's health form when they walk in your door. In addition to that, if you look at the New Hampshire Child Care licensing health form that they put out on their website, as well as New Hampshire Department of Education, those health form templates that they put out actually have spaces for blood lead level tests to be entered. So again, you're not asking for anything that isn't already required or that there isn't already a space for on most forms. You're just requiring it for entry. Imagine that information that provides for the school when you begin to work with these children, and if you're beginning to see red flags in their behaviors or their learning. You can, if you're seeing that in their medical record, you know that this may be a factor, and would have better guidance on how to best support those children. So that would be my recommendation for Nashua. If someone reaches out to me or Claremont school superintendent or mayor, they can send you their policy. I have it as well. But it was passed unanimously by their school board, and I would encourage every other district to do that.
That's an excellent idea, Gail, and you know, it's great to see how it's worked in some other areas. So it doesn't look like we have any more questions. So
Perfect.
with that, if folks do have questions, Gail provided her contact information. You can reach out to her. You can reach out to myself, Patty Crooker, Nicole, or Jessica Hillman at the division. We can get in touch with Gail or other subject matter experts as needed. And I want to thank you, Gail, for your time and all the great information you shared.
The last thing I would mention, if there are people still listening to this broadcast, is this type of training and similar ones that are done by my colleagues are, if you will, part of our job. So we can come anywhere, nearly any time. I guess now it's largely virtual, but before that I used to log a lot of miles driving throughout the state, and we can do these trainings free of charge for your medical group, for your school district, for your PTA, for your parent group, your church group, your 4-H group, your real estate group, and we can tailor it to the needs of your group. So please feel free to reach out. We'd be happy to come. Thank you.
Thank you all, and enjoy the rest of your day. Thanks again, Gail.
Thank you.